Check out this week's StayCurrent Short. Hereditary non polyposis colon cancer syndromes are related to defects in the mismatch repair genes and either lead to Lynch syndrome, which is autosomal dominant, or constitutional mismatch repair defect, CMMD, an autosomal recessive disease.
So Lynch syndrome, because you guys, from the adult side certainly have heard about this, but it's hereditary non polyposis colorectal cancer from dominant mutations in the mismatch repair genes, and it's present in 3 to 5% of all colon cancers and 3% of all uterine cancers.
That's Dr. Joseph Palermo. He's a pediatric gastroenterologist and a member of the multidisciplinary polyposis team at Cincinnati Children's Hospital. Patients with Lynch syndrome start screening between 20 to 30 years old. The exact guidelines vary based on which gene mutation is present, but screening is important.
So for Lynch syndrome, we do our initial screening and colonoscopy every 1 to 2 years. Again, this is predominantly more in adults. And so if they have mutations in MLH1 or 2 or MSH2, they start at 20 to 25 years of age. Mutations in MSH6 or PMS2, they start at 25 to 30 years of age. It can be earlier if they have a first-degree relative with cancer.
CMMRD, however, is very aggressive and leads to both GI and non-GI cancers in patients less than 25 years old. So screening happens at a much younger age, and it's on a pretty intense schedule with regular follow-up every 6 months.
And then the constitutional mismatch repair defects, if they have a known mutation and family history, we start very early at every 8 years with their colonoscopy. But other tumors start even earlier. So if they have brain tumors and they have a known mutation, to screen for brain tumors in somebody with a known mutation, we start as early as age 2. And for other mutations, for the leukemias and lymphomas, we start at age 1 with CBCs and exams.
For pediatric patients with polyposis syndromes, the transition to adulthood can be tough, and so assuring that appropriate transfer of care to an adult GI team or colorectal surgeon is an important part of their overall care plan.
And again, they need extraintestinal screening as well, this is where coordination, multidisciplinary coordination is important, especially when these patients transition to the adult side, to make sure that not just their colon screening, but all the other screenings continue.
Check out the full episode on YouTube, the StayCurrent app, or SoundCloud. Find the links below.